And as we're talking about these cold to hot conditions, we also have to talk about flu season, which is just around the corner. COVID-19 cases are also increasing, and health officials are urging people to get the vaccine.
The CDC says adults of underrepresented racial and ethnic groups are less likely to be vaccinated against influenza and more likely to be hospitalized for it. ABC 10's race and culture reporter Candace Red explains.
Oh, I remember these days in the hospital.
While turning the pages of a photo book, Trish Morris shares the story of her twins born prematurely in 2003.
When my twins were born, they were born, at 24 weeks.
Before bringing her babies home, Trish says she did something she's never done in her life. She got a flu shot.
So the one important thing that the nurses always stressed is that because of them having chronic lung disease, that we had to get our flu vaccinations and get our shots for the entire family.
Health officials say babies younger than 6 months are at high risk of serious flu complications, but they're too young to get a flu vaccine. That's why anyone who cares for the baby should get vaccinated.
Because, flu is real, so you definitely don't want to spread that in our communities and spread it to others.
Trish says she's been getting the flu shot every year since 2003.
I just got it again when I went in for my physical. It's been fine for me and my family.
Doctors say the best way to prevent the flu is by getting vaccinated.
The flu vaccine does not give you the flu. Now, you may have a side effect, a normal side effect of the flu shot like you would with any vaccine.
According to the CDC, flu hospitalization rates are nearly 80% higher among Black people compared to white people, 30% higher among Native Americans, 20% higher among Hispanic people. Some of the challenges include misinformation and mistrust of the medical system.
It's going to take providers like us, the physicians and the medical community, working alongside with the health plans, with the county, with community-based groups, all of us together, getting that correct information out. I think it's important to find a provider that you can connect with, that you can feel comfortable with, and build a relationship. And that's what we try to do with all of our patients.
And we just need to educate ourselves and decide what's best for ourselves and our families and our loved ones.
And health officials say trust is key to addressing vaccine concerns. She was knocking all up my street because I just got my first flu vaccine this year. And it just goes to show it is important to kind of talk with your doctor and decide if it's something that's best for you.
Yes, and protect yourself in a way that you feel comfortable with. And partnerships with community organizations and pop-up clinics can help increase the vaccination rates and combat misinformation.